Hi, I'm Lori from HIS Talk. Welcome and thanks for joining us for today's webinar. It's titled Turn Your Contact Center into a Patient-Centered Access Center, and it's brought to you by West Healthcare Practice. Before I get started, I have a few things to make you aware of. Attendee phone lines have been muted to prevent background noise. You can use GoToWebinar's questions box in the console to submit questions to our presenter at any time. The presenter will answer your questions during Q&A at the end. Today's webinar is being recorded, so you'll receive links to the recording and a PDF version of the PowerPoint presentation in a follow-up email. Our presenter today is Brian Cooper. Brian is the Patient Engagement Strategist at West Healthcare Practice. With that, I'll turn it over to you, Brian.
Thanks, Lori. Appreciate it, and thank you, everyone, for taking the time out of your busy day to join. I think hopefully you'll find this session interesting. I think our learning objectives for today really are simple. What we wanted to do is really outline some of the common pitfalls that we see out there in the market when we engage a traditional contact center, and what are some of the components as we look to drive them forward into a next generation environment that play into that strategy. And then how does that solution work? What are the elements behind it that drive the solution, and then how do you build the business value around that solution as well in terms of identifying the value and being able to articulate that within your organization. And then how do you tie the access center into your population health management overall strategy and care coordination initiatives? Those things tend to need to work together to drive an effective patient engagement strategy. And then finally, what's an easy kind of three-phase roadmap that you can follow to start to implement some of these initiatives and objectives? So with that, I will step right in. I wanted to start with just kind of a market point of view with regard to today's access center. And you may have seen briefly on the slide, I've been in this industry in terms of helping large clients develop consumer, patient, and member engagement strategies for over 20 years. And I've spent a lot of time in the contact center. And I subscribe to a lot of different blogs and articles. And one of my favorites is Paul Romer. And he has a blog that comes out quite often. And this one really got my attention. I thought it was relevant for today. So when you think about today's environment in the access center, hospitals and health systems haven't traditionally been focused on, access contact centers. They're focused on driving quality care and making sure that they're driving the appropriate outcomes with their patients. And certainly that paradigm is shifting. So, as that's occurred, they've had the requirement to be able to answer calls that come into the hospital. A lot of times, those calls can land in, 10, 15 different areas, different pods. Sometimes they'll land in a consolidated environment. But consistently when I talk to the individuals running these contact centers, what you see is kind of the strategy around it tends to be kind of buildings and people. How do I grow? I just build more buildings and add more people to sit in those buildings. And I think the contact center today in a hospital or health system is also kind of following that path. And I have phone calls, and I get a lot of them, especially on Mondays, Tuesdays, Wednesdays, if you work in an access center. I need to answer those calls, and so I got to put a bunch of people on the phone to answer those calls. And it's been an immediate need and driving to an outcome, which is I have to answer phone calls. And so you can see how that environment has kind of been established, and certainly with the trends that are taking place in the market, things like consumerism where, the patient is a consumer. They have higher expectations. We're all customers. We all deal with our cable companies. We all deal with our retail, our favorite retailers, and we have a certain experience when we interact with those companies. And as patients, now that we look at how the market's changing, patients also have those same expectations of your access center. So as we go through this, we'll talk about how do you bring your access center up to the level where today's consumer would expect to be handled. Some of the other things to consider as we talk through this in terms of market shifts is the shift from fee-for-service to fee-for-value. And how do you effectively manage a patient outside of the four walls of your hospital? Again, hasn't been a traditional focus, but certainly is in today's environment. The market's much more competitive. The user experience has to be, as expected. And so, looking at patient engagement across the entire communication pathway is critical. So when we look at the environment today and the current state of patient communications, and we look at it across the care continuum, you can see that the patient tends to be on the periphery. They tend to be engaged, only when they need to, only when they actually have to go see a physician or have to go to the hospital, or for some reason the healthcare system or hospital has to reach out to the patient. It's not the best strategy for driving accountability at the patient level and ultimately driving overall better patient outcomes and reducing the cost of care in today's environment. So what are some of the key pitfalls that I see? And I've spent the last 2 years essentially knee-deep in contact centers in hospitals and health systems, and this is pretty consistent in terms of what I see when I'm talking to these groups. And so some of the key challenges are there's no single front door. So, I've obviously been a patient many times myself. I kind of equate this to, when you drive up to a hospital, especially a large health system, you don't necessarily know exactly where to go. There's a whole bunch of buildings, a whole bunch of doors, which one's the right one, and of course I inevitably walk in the one that's 2 miles from where I need to be. But the same idea applies to the access center. So when you think about how does a patient identify where to call, where to go, we live in a search first, act later environment, meaning as consumers, we'll go to a website, we'll try to find the information ourselves, we'll try to self-serve. If we can't, we'll pick up the phone and call in. And in most cases, those calls can land in any number of places. In a lot of cases, there's tens, even hundreds of phone numbers for patients to call. So they don't necessarily even know which number to call to resolve the issue that they have. And that creates, obviously, a challenging experience getting to the right place, and certainly can create a lot of issues in terms of cost. So if you think about where those calls land, having to be transferred from one place to another, think about a patient who's calling in to ask a question. They call the clinic can't answer the question. The call then gets transferred into the access center, only to find out that it has to actually be transferred back to the clinic. We find that those situations occur very frequently and are not uncommon. So in fact, I'll give you a quick example. In working with one of our clients, we conduct a lot of focus groups to talk to patients and talk to access center staff to find out what some of the challenges are. And in one of our focus groups, we had a patient who made the comment, I'd rather walk into the hospital than actually make a call into the hospital. And that's pretty telling. So it's a very real challenge and one that obviously needs to be addressed. The other thing that we see is there's not a lot of self-service and there's not a lot of personalization associated with these interactions. So we've learned over the years, as we've dealt with our commercial clients, as they've worked to drive loyalty with their customer base, they've created these concepts of personalization and intelligent interactions to drive trust and loyalty with their customer base. The same thing applies in the access center. And being able to drive self-service that is trustworthy, and by trustworthy I mean create a user interface that will identify who that person is and treat that person accordingly, that can make a lot of difference in building that trust. Today's environment doesn't necessarily do that. You run into a menu. That menu is the same every time you call. It can be frustrating if you're looking to do one thing and the menu only offers you, 3 things, none of which are what you want to do. And we've figured out that one size does not fit all when you're looking at front-end self-service before transferring to an agent. The other thing that we see is the lack of data, and that applies in a few different areas. So think about the scenario where you call in maybe to reschedule an appointment. You go through the initial prompting and triage that's in place today, give some information, and then you get transferred to an Access Center agent, only to have them ask you that same information again. And this may even be after you've been to the web. So you've been to the web, you've tried to solve your problem, you've now picked up the phone, you've answered the questions in the automated system, and then you get transferred to an agent who then asks you for that information yet again. So the passing of data has been a challenge across multi-channels in the current contact center environment. In addition, there's a lack of visibility in terms of interaction data, being able to dig in and see either in real time how your contact center is operating against key performance indicators. How are your service levels? How are they this year over last year? How are your agents performing? Do you have a solid agent performance management solution in place? And are there analytics around the transactional data that you can leverage to drive actionable recommendations to improve? And those are all areas that are a challenge. In addition, in a lot of cases, we'll see EMR data or practice management data or other data sources disparate. So there's disparate systems. It's not consolidated, which creates multiple screens that your agents may have to tap into in order to ultimately find the information they need to help the caller. And then finally, we've seen quite a bit of single-threadedness in the Access Center space. Again, this comes out of, I think, the immediate need of, we have a bunch of calls, we've got to build out some seats and put people in those seats, answer those calls, and that can be, again, across multiple sites or maybe in a single site. But in any case, there's no real redundancy around business continuity and disaster recovery. And with one of our clients, they've had a pretty rough winter. Some of you may have experienced the same. Ice storms, things like that, where the agents, for whatever reason, can't get into the contact center. And they run into some real issues and challenges handling calls when there's no option for either a second site for those agents to go to, or perhaps the ability to work remotely, which would be ideal. So that tends to be an issue. And then, of course, if you have the ultimate disaster where your contact center simply becomes inoperable, then you've got a real issue from a risk perspective, both business risk but also clinical risk, which is lives potentially being impacted. So those are some of the common pitfalls that we run into in the market. When we look at the future state, we start to look forward at, how do you build an effective patient-centered access environment? The patient is at the middle. So when you look at that care continuum, it really wraps around that patient. And every aspect of what that patient does should be known, or at least the information should be able to be shared across the multiple touch points of that care continuum. And we've come up with this kind of saying over the last couple of years of know me, show me that you know me, and show me that you care about me. And I'll talk a little bit about how that works here in a second. But the idea is, again, to create that personalization regardless of the touch point, and then leverage that information across other touch points throughout the care continuum. So an example might be in a scheduling scenario, maybe I can capture the communication preferences of the patient. before you're admitted for your surgery, how would you like us to contact you to give you pre-surgery instructions or pre-admission instructions? Would you like an email? Would you like a phone call? And then, post-discharge, how would you like us to notify you to remind you of your medication or to check up on your adherence to your care plan? For a hypertensive patient, maybe it's the capturing of a blood pressure reading morning and evening for 2 weeks or whatever the protocol might require. So there's options in terms of what do you want to do to drive a better patient experience across that continuum, and then how do you want to leverage that information when that patient either reaches out to you or you're proactively reaching out to that patient. So with that in mind, what are the key components for a patient-centered access center environment? And really they kind of fall in 5 different categories. So as we look at some of the solutions that we worked with our clients to build, the first idea is to create a single front door. And think of a concierge when you walk into a hotel who knows you. You've been there many times. They know your preferences. They know what restaurants you like to eat at. They know, where you like to go for entertainment, those types of things. The same concept applies here. So the idea is to create a single environment through an automated system that is built to provide a consistent user experience and to represent your brand effectively. And that doesn't mean that you have to build out an 800 number and redirect everyone to that 800 number and change all your marketing and change your website to do all this. What it does mean, though, is that you can work with a company like West or others to drive calls into this environment wherever they may land. So in some cases, you may have calls coming straight into your access center, and in other cases, they may land at a clinic first and then be redirected to an access center. But in any case, that first touch within the access center should have that single front door effect. That gives you visibility of that patient. Things like bidirectional intelligence play a role in there. So if you think about the use case of, I have an appointment, I've received an appointment reminder, I've confirmed my appointment, but now I've got a question. Maybe I want directions, or I have a question about, do I need to fast before my appointment, whatever it might be. So now I'm going to call in to ask the question. So when I call in, the system should be smart enough to know, number one, I reached out to this person, they've confirmed their appointment. Let's acknowledge that right out of the gate once we authenticate them. Secondarily, let's acknowledge that, I see you have an upcoming appointment today, and then direct them down the appropriate path. Effective here is to leverage intelligence and any other information that you have within your systems, interaction intelligence and information in your systems, to reduce that caller's effort. Get them to where they need to go as quickly as possible based on what you know. Speed to resolution is key to a patient satisfaction component. So when we think about patient-centered interactions, other things that you might want to look at are, how do you leverage self-service? So once you've identified who that caller is, how can you then start to drive some additional self-service and take some of those less complex transactions off of your access center agents and move them into automation? So if you think about, let's say it takes 10 steps to process an appointment reschedule call in your access center, and you're able to move 5 of those 10 steps into an automated environment with a well-designed self-service IVR application. If you're able to do that, now you're able to take a 4.5-minute or a 4-minute agent call, and you're able to put 2 of those minutes into a much lower cost environment, create a better user experience, and then now you've only got a 2-minute agent call. So the net of that is you've got a huge shift in terms of your cost structure, and you've found that kind of ideal blend between self-service and a live agent experience. So that's where we really work with our customers to identify what's that low-hanging fruit that we can leverage in a contact center to drive into automation. And then look at the data. So when you think about the capturing of these interactions as they come into that single front door, how can you leverage that data over time to be either more proactive? So you might find that you have a lot of people calling in for certain reasons. Maybe it's pre-admission questions. And that's going to drive a strategy around proactively engaging your patients pre-admission. So you can use that data to then identify opportunities to reach out to a caller so they don't even have to call you, right? A lot of people say if your customers or patients have to call you, you've already failed because you haven't been proactive enough in reaching out to them. So leveraging insights to be more proactive, but also when you have to be reactive and you have to answer that call, how can you be smarter about it? So maybe out of the gate, all you do is look for, okay, does this person have an appointment? In the future, as that system grows and as you gain more information, maybe you're going to look at, oh, they've been recently discharged. They haven't registered for my portal yet. So, and I can identify that they're calling from a mobile phone. So perhaps you want to offer them a text message with a link to the portal and say, oh, I see that you haven't registered for the portal yet. Would you like me to text you a link? And that does a few things. Obviously, it'll drive portal adoption, which I know is a huge challenge today. It will open up a secondary channel for communication with that patient and a lower cost channel. Text is a hugely growing channel. It's being adopted at exponential rates across not just the younger demographic, but even the older, more mature demographics as well. So being able to communicate with your patients via text and get the opt-in for that communication through the voice channel is a huge value-added component. So using cross-channel data can continue to drive value both to your patients but also to your organization. And then finally, looking at a cloud-based platform versus a premise-based platform is a great way to have built-in redundancy. So most of the hospitals and health systems I'm talking to are looking at cloud-based managed service environments where they don't have any single-threaded technology in their contact center that could cause them potentially extended outages. It also gives them flexibility to allow their agents to work remotely either on a continual basis. Maybe they want a percentage of their agents to work remote for various reasons. They have a hard time recruiting people. They've got specific skill sets they need to recruit for, and they're not local, so they want to recruit outside of their traditional recruiting area. Or it's just purely a disaster recovery opportunity where in an ice storm, snowstorm, there's a fire in the building, who knows, they have the ability to work remotely. As long as they have access to an internet connection and they can register a phone, it could even be their cell phone, they can take phone calls. So these are some of the key components that we see as being kind of a next generation patient-centered access environment. So how does this all work? We talked about the idea, the concept of know me, show me that you know me, and show me that you care. That's really how this thing works over time. It's a continual cycle. The know me is, what do I know about you at the moment I answer that phone? Do I know that you've been recently discharged? Do I know that you have an upcoming appointment? Do I know that you recently canceled an appointment? Do I know that you called 3 times in the last 30 days? All those different things can play into how do I handle your particular phone call at that time. And then that drives which self-service menuing options am I going to give you before I transfer you to an agent. Obviously, we're going to authenticate the call, make sure we know who's calling. Is it the patient? Is it their caregiver? Is it a physician? on behalf of the patient. Once we've identified that, the way we show them that they know them is that we offer them the treatment or the handling that we believe they're looking for in that particular scenario. So if I'm calling in, if I just received an appointment reminder and now I'm calling in 10 minutes later with a question and you authenticate me and say, oh, I see you're calling about your upcoming appointment, I'm immediately going to be ready to engage with that system. It's built trust. It's personalized the communication by showing me that it knows I've got an upcoming appointment or that I've been recently discharged. If you think about even a broader scenario where maybe I've been recently discharged and I'm on a care plan. I'm a hypertensive patient, high risk for readmission. I'm on a very specific protocol care plan which says I have to give my blood pressure reading every morning and every evening. And I'm calling in the morning. Perhaps it says, oh, are you calling about your appointment? Yes, I am. Where do I need to go? Would you like to send us directions? I go ahead and text that out to the patient, and then I say, oh, I see, by the way, you haven't provided your morning blood pressure reading. Would you like to give us that reading now? So now you're starting to bridge the gap between access and clinical management or care coordination environments and overall population health. And you're doing this all through this single front door intelligent environment. And then the show me you care is how do you handle that after that self-service? So were you able to accomplish exactly what they wanted to in the automated environment? If so, fantastic. If not, then transfer that patient to the appropriate agent with the appropriate skill group and the appropriate pod with the data. That's the key. So being able to bridge that gap between automation and a live agent, a smooth transition into that environment where the agent can pick up the phone, they know exactly who's calling, they can greet you by name, say, oh, I see you've been trying to do ABC, how can I help you with that? That shows them that you care. So you've got that consistent user experience across the board. And then after that transaction's over, log it and apply it for next time. So again, you've got a learning system that starts to allow you to do some things like predictive intent modeling and just continue to build on the intelligence that you've already started with basic business rules over time. So when we think about the self-service component of the patient-centered access environment, there's some low-hanging fruit that we've identified in the work that we've done with a lot of hospitals and health systems over the last few years. And I'm sure this is consistent probably with your environment as well. So certainly appointments are a huge call driver in an access center. Automation is perfect for confirming an appointment, allowing patients to cancel an appointment. There's some scenarios where cancellation might require a transfer. Absolutely can build that logic into your self-service environment. So certain appointments, no problem, can cancel. Other appointments you want to hand off to an agent because you want to try to get them rescheduled immediately, given their risk, their disease state, whatever it happens to be. And then rescheduling. So rescheduling is something that we typically see handled by an agent, but again, it's can I take the 5 tasks out of the 10 that an agent would typically do and move that into automation and allow the agent to then take over for those last 5, finding that balance. Refills and renewals, another big call driver. In a health system that I recently worked with, I think it was about 50% of their calls were related to renewals. And renewals are obviously different than refills, but these are where you've got 3 refills and you're on your last refill. You've taken your last pill. Now you realize you try to get a refill. They say, oh, you got to talk to your doctor. Now you're calling in saying, I need to talk to my doctor. That's typically the scenario I fall into. But there's all kinds of logic you can build around that in a self-service environment to address either those transactions completely in the self-service environment or at least partially. Directions and FAQs, other areas of opportunity from a self-service perspective. We deal with a lot of health systems that, and particularly, when you've got a an ACO environment where you've got regional hospitals and health systems collaborating, and you got people driving in from outside of the region who aren't familiar. You get a lot of calls coming in for directions, or even people local, like the scenario that I had where I don't know which building to go to. So there's directions that can be provided verbally or via text-to-speech to a caller. There's links to directions. There's all kinds of things that you can do, again, to drive mobile adoption and those types of things through the directions calls. And then just basic FAQs. So questions about pre-admission, pre-appointment instructions, and then general FAQs as well. And we feel like, or we've seen anyway in our experience, that you can address a good 65% of your inbound calls in these 4 areas, at least through partial automation. So as you look at the deployment of a next generation patient access environment, particularly when it comes to self-service or contact center technologies, there's 2 key areas of focus in terms of building the business case. Obviously, you've got your quantitative area, and that's typically driven around cost savings. But you also have a qualitative area which drives more toward the softer side of the business case, which is around driving more loyalty, revenue, obviously, for your health system, and maintaining those patients within your network. We've also talked to a lot of health systems about using these types of solutions to drive patients to a certain outcome. It might be to keep them out of the ED, might be driving them to clinics. There's a huge issue out there, as you all know, I'm sure, are patients coming in using the ED as their primary care physician's office. So if you can be proactive and reach out to those patients to drive them to another location, obviously there's a huge cost savings component to that. On the quantitative side, when you're looking at building the business case and you think about removing those 5 tasks from the 10 that the agent has to accomplish to complete a call, you land in 4 key areas to build that case. One is you're going to reduce the overall length of call when you find that blend between automation and a live agent experience. You're going to reduce the agent talk time, and agent talk times can be anywhere, 50 cents per minute fully loaded to, even 75 cents. It can be kind of all over the board, but for every minute that you reduce off that agent, you're going to save a significant amount of money. Reducing call transfers, so that idea of a call landing in a clinic and then having to be transferred over to the access center, then back to the clinic, then maybe somewhere else. There's a cost to each one of those transfers. Even if it's a local number being transferred across your own network, you're still engaging resources who can't solve the problem, and there's a cost to those resources. So you need to think about what is that cost of that transfer. And then repeat calls. If your service levels, if you don't have a solid front-end solution to be able to peel some of those less complex transactions off of your agents, and you get into a high service level scenario, high wait times, you're going to create poor satisfaction, but you're also going to drive repeat calls, which is another cost driver that you need to consider when you're building your business case. On the qualitative side, obviously patient satisfaction is key. We talk a lot about surveys, making sure that surveys are at least a consideration when you're looking at deploying a solution like this, so that you can baseline your performance, and then you can obviously use your data to drive optimization against those baselines. Reducing patient effort, we already talked about. Increased speed to resolution is a part of that, and then overall trust and loyalty is what you're going to get out of a solution like this. A quick case in point, one of the use case examples from a client that we're working with, their access center is about 300 seats. We're able to reduce their overall expenses by up to 30%, which is an annual operational cost reduction of about $2 million. So depending on the size of your environment, And whether you're consolidated or you have disparate pods, we can work with you on, what does that particular business case look like for you, but it's significant savings. And if you're thinking about, I got to go out and hire 20, 30 people because our service levels are incredibly high, before you go hire those people, I would strongly recommend that you look at a solution like this, because if implemented, you may not need those people at all. So how do you pull it all together? So the way I look at this is really there's three key components to the overall solution. This ties back to how does this tie into your care coordination strategy, your population health strategy, your access center strategy. They're all intertwined. Your patients are communicating, again, with your hospital or health system on a regular basis across multiple touch points. So certainly you have your IT considerations. You've got to have access to data in the EMR. There's other potential systems that you're accessing as well. Those have to be a part of the overall mix. But the access center can very easily be tied into your care coordination and your population health management system, both through the technology but also through the intelligence. Again, if you have visibility into that patient's record, you've been able to track the transactions associated with that patient, you can see, have they been on the web? If they have and they're calling, and maybe they've been trying to pay a bill, and you can acknowledge, I see you've been on the web trying to pay a bill. How can I help you with that in the automated environment? And billing and payment applications and automation work incredibly well and are hugely effective. The idea of minimizing touch points. So if you think about, you've got patients that you're reaching out to about appointments, you've got patients you're reaching out to about treatment plans, adherence plans, you've got you're proactively reaching out to remind them of a flu shot, so you've got wellness and prevention. You've got all these different contacts that are taking place. If you can minimize those and minimize that fatigue of the patient contact, and when you get a hold of that patient, whether it's through a proactive notification or whether it's a call coming into the access center, and you have the ability to capture multiple pieces of information, you can reconfirm an appointment, you can verify they haven't given their blood pressure reading, you want to give that to us now. I see you might have an upcoming appointment in 2 weeks, do you want to get that scheduled now? So there's all kinds of things that you can build in to try to minimize the number of touches that you have to make to a given patient. So that's really how you tie all those elements together across the different groups within your organization. So what's your roadmap to success? And these are the three steps that I throw out. And obviously, depending on where you are in your kind of transformation life cycle and what you're looking at from an access perspective, you may start here at phase 1, or you may be all the way at phase 3. But the way I look at it is the initial phase is all about automating, creating that single front door, creating a consistent user experience that's dynamic, where you can personalize the interaction, even just based on simple business rules like, does this patient have an appointment coming up, or did they just have an appointment, or were they just discharged? Capture their intent, understand why they're calling, and then store that data for use later. And then leverage self-service, some of that low-hanging fruit that we talked about, to try to pull some of the less complex transactions off of your agents. And then pass the data that you capture in your automated system to the agent so that they can easily transition that call. It's a nice, smooth transition, a great user experience. And you've all been customers where you've had the agent pick up the phone and greet you by name and acknowledge why you're calling and be able to take care of you very simply, and it feels really good. So that's really the phase 1. It's as simple as those 4 key things. As you go into then phase 2, kind of a more mature state, now you've got some data through that first phase. Leverage that data to start to build additional intelligence either within your access environment or even across environments. So now start thinking about, how can I reach into my care coordination team and get some of their information. So if they're trying to if you have a care coordinator that's trying to reach out to a patient, they've not been successful. We've seen that a lot. Care coordinators can make 10, 15 phone calls before they actually talk to a patient. Now the patient's calling into your access center. You want to be able to capture that patient and potentially maybe even transfer them into a care coordinator if the protocol requires that. So start to look at outside environment. Use the interaction data to be more proactive. Create a proactive engagement strategy with that data, again, to keep them from calling in at all, if at all possible. And then leverage your IVR to drive the adoption of alternate channels. So use it to identify, are you calling from a mobile phone? Try to get them to opt into the text channel if it makes sense. And then you can leverage that text channel for future communications with that patient. And then finally, look at surveys. So you may want to look at that in the initial phase, but if you don't want to do that in phase 1, you definitely want to do that in phase 2. Make sure that you're able to baseline your performance so that you can put optimization strategies around improving that baseline. And then the final phase is really looking at the enterprise. So can you capture that patient's preferences? Preference is a huge buzzword out there, and it's a huge driver from a satisfaction perspective. It's also a huge driver in terms of getting patients to actually be more proactive with their own care, take more accountability in their own care. If you're communicating with me via the channel of my choice, I'm going to be much more likely to engage with you. So where do you have an opportunity to capture those preferences within those various patient touch points? Leverage cross-channel data. So can you tap into your web data? Do you have a mobile application? Can you tie that in? Or a mobile optimized website even? Can you tap into your portal? And can you leverage that information in terms of transactional data in those areas in your access center environment and be able to acknowledge what has this patient done in those environments and how can I use that data to get smarter about how I transact with this patient at that given time. There's also this concept of texting at the desktop. So there are some applications where you can actually have an agent via an IM type screen send a text to a patient if you know that's their preferred channel. That patient then receives that message as a text. They can respond as a text back to the agent and it appears in the IM screen. So it's a real-time, fluid, open-ended interaction that takes place in a completely different channel. So look at solutions like that where you can, again, engage that patient in their channel of choice to drive better outcomes. And then look at things like collaboration, web conferencing, things like that. We have a virtual care center that is a single access point for that patient where they can go and learn about their disease, drive prevention and wellness. They can also, it can also handle telehealth, telemedicine types of applications, one-on-one consults with physicians. So it's a very powerful tool when you look at web conferencing and collaborative environments to augment your access center strategy. So that's really kind of that 360-degree view of the patient environment once you get into phase 3. So that's really, I think, the end of the overall presentation. Hopefully that was helpful in terms of how to think about driving your contact center into a patient-centered access environment. Just a little bit about West Corporation. We've been around for about 26 years. We're a leading provider in technology communication services in multiple industries, every industry out there, healthcare obviously being a huge focus of ours. We're obviously huge transactional platform. We're the largest conferencing and collaboration company in the world. We send billions of transactions across multiple channels in support of our clients in the healthcare space as well as outside. We offer advocacy service as well in support of employers across the United States, where we've got nurses and advocates on the phone to help patients with anything and everything with regard to healthcare, from how do I pay my bill to, how do I treat my diabetes to where do I find a doctor, those types of things, and then certainly proactive and outbound notifications to patients as well as inbound, which we spend a lot of time just talking about. And we also are the backbone of the 911 system in the United States. So uptime obviously is a huge part of our business. So thank you very much. I really appreciate everyone's time. If you want to learn more, you want to reach out, you can visit our website at west.com, or you can reach out to me at the number here or my email, and I'd be happy to spend some time talking to you. Lori, back to you.
Okay, thanks, Brian. Now we'd like to open it up to the audience for questions. As a reminder, please use the questions section on the GoToWebinar panel to submit your questions. The first one, our IT department is backed up with a lot of projects, and we have technology in our access center that simply will not do these best practice things. When modernizing the contact center, is it generally better to have all that technology on site, or is it safe and compliant to do those things in the cloud?
Yeah, that's a great question. So a couple things. One is IT and IT priorities are always going to be a consideration when you're looking at a solution like this. And we work with our clients to align with their IT objectives. Many process of moving, let's say, into a voice over IP environment, and so we can align with that as we look at how our cloud can tap into and stay on network in their voice over IP environment. With regard to cloud-based systems have been around for a long time, and they typically drive much higher service levels around redundancy as well as scalability. So in the West environment, we've got essentially unlimited capacity and can allow for growth as well as spikes that we know occur in an access center environment. So and cloud-based environments are very safe in terms of data protection and information security, all PCI compliant, PHI, PII, HIPAA. So no worries in terms of the safety of the data in those environments.
Okay, here's another one. We've gone through a merger recently and we'll be combining patient access centers. What's the best way to consolidate when there are different technologies in play, especially when those investments aren't fully depreciated?
Yeah, another great question. So you always have to take a look at your previous investments and how you want to leverage those investments in the future. In terms of the technology that we're talking about, the technology is ideal for consolidation. So a lot of the hospitals and health systems that we're talking about are in the process of consolidating. And so if you're in that process and you're looking at how do I get that technology kind of, consolidated as well. You got to consolidate the people in the facilities, but you also have to consolidate the technology. Now's the perfect time to be thinking about a cloud-based solution. When you're looking at your existing technologies and where you are in the depreciation cycle, those are just things that we'd talk you through and try to work with you to figure out how you can leverage those and perhaps a phased approach so that you can maximize the value of those assets while also maximizing the value of a cloud-based solution.
Thank you. Here's another. We struggle with performance reporting without current contact center technology. What advice would you give me about reporting?
Yeah, again, it's a challenge, and we talked about data, early on and lack of visibility. We see this a lot when we're dealing with clients, and a lot of times they're flying blind. They don't have good visibility into the performance of their agents or even their overall contact center environment as a result of lack of data. If there is a self-service environment in front of the contact center, a lot of times there's no reporting around that either. So not a strange problem at all, but something that a next generation solution can absolutely address.
Great. Thank you, Brian. That was our last question, so that will conclude our webinar. I want to thank everyone for joining us today, and again, thank you, Brian, for an interesting and informative presentation. Attendees, watch your email for links to the recording of today's webinar as well as the PDF version of the PowerPoint presentation. We look forward to seeing all of you again at our next HIS Talk webinar. Enjoy the rest of the day.
Thank you.